Welcome to Restore the Glory podcast. My name is Jake Kim.
And I'm Bob Schutz.
We're two Catholic therapists sharing what we've learned personally and professionally to help you on the journey of restoration.
If you've been blessed by our podcast, please prayerfully consider partnering with us on Patreon. Your support will help cover the cost to produce the podcast, but will also give you access to exclusive content like monthly reflections and special live stream teachings. Go to patreon.com/restoretheglory and join the mission of experiencing the restoration of our God-given glory.
Hey, Bob, good to see you again. I hope you're doing well. I'm just going to skip by the pleasantries because I'm too excited to talk to our guest. I see you all the time. So good to see you, Bob. Okay, here we go. So, Bob, we have back on Dr. Christin McIntyre. So welcome back, Christin. You were with us a few episodes ago. I can't remember how many. And Bob and I kind of left that conversation on a bit of a cliffhanger, and we wanted to get back into some things. So I'm so excited that you joined us again. So listeners, if you haven't listened to that first episode, I would really encourage you to go check that out, where we talk about all kinds of fun things in Christin's background as a psychiatrist and mental health professional, etc. Okay, is that a good enough intro so we can get into the juice of this?
Sounds great.
Okay, Bob, are you good to go?
Jump in.
All right, here we go. So one of the things that we were hoping to talk about was the concept of personality disorder. And so we all, in our professional formation and training, this is something you get a lot of training in, blah, blah, blah. But what's really interesting is what's the church's take on this? And I mean, we could go 1,000 different directions. You know, how the church treated personality disorder 1,000 years ago, and people criticize and blah, blah, blah. I don't know if we want to go there, but I'm going to kick us off by giving us a definition of personality disorder. And then maybe there's other definitions we've encountered, and then let's start there, and then we'll see where the conversation goes. Is that, everybody feel good with that?
Mm-hmm.
Yep. Okay. So the definition I'm drawing from, I want to give credit to Dr. Christina Lynch. I know that might be confusing. Christin McIntyre is with us today as our guest, but Dr. Christina Lynch, she is a psychologist who used to work at St. John Vianney Seminary in Denver, and I know is retired now. I have great respect for her and have heard wonderful things about her. So she has this little booklet where she talks about personality disorder. And here's what she says, and she's a Catholic psychologist. Here's what she says, and maybe this can kick us off in this whole domain of breaking open what a personality disorder is. So she says, a personality disorder is identified by a pervasive pattern of experience and behavior that is abnormal with respect to any two of the following: thinking, mood, personal relations, impulse control. Okay, so I'll read that again quickly. Personality disorder is identified by a pervasive pattern of experience and behavior that is abnormal with respect to any two of the following: thinking, mood, personal relations, impulse control. So personality disorders, it's out there in the culture, right? Like it's almost, I'm noticing this in some younger generations where if you have a personality disorder, it's almost cool. Like there's this vibe that's out there that's like, oh, I have depression. And it's like a badge you kind of toss around. So I'm noticing, since I went to graduate school and today, the culture has really changed its perspective on personality disorder, which starts to beg the question, what is it? What does it mean? How do we understand it as Catholics, et cetera? So, okay. Christin, what comes to mind when you hear that definition? What's first stuff that jumps out to you?
Well, the first thing is that that is basically, I mean, almost word for word the definition from, well, it actually is from the DSM, with one change.
Ah.
The one thing that the DSM includes in there is that it deviates markedly, this enduring pattern or pervasive pattern of inner experience and behavior deviates markedly from the expectations of the individual's culture.
Ooh.
And so right there, you've introduced this hugely subjective component, which is really interesting. It might be helpful, actually. I mean, because for the listeners, some people are going to be very familiar what a personality disorder is, and other people might not be as much. And I don't know that I'm exactly but I mean, clinically, we have a way of defining these things. I think colloquially or casually, we all know difficult people and people who seem to have a more difficult time sort of responding to things in a way that we can relate to and think is normal or typical. I think two things have really put you mentioned that the culture has changed with respect to recognizing this and understanding it. I think a couple of things have happened recently. One is that movie from a few years back, Girl Interrupted. You remember that one?
I don't.
Oh, okay. And I it's been so long since I've seen it, I can't really speak to it. But basically, it's a story of a young woman with borderline personality disorder in essence, and she is put in a residential facility for a long time as an adolescent, and it the people that she encounters there and the things she's going through herself. But I mean, it really
wow.
I think that brought it into the public conversation more than it had been. But the other thing that I would point to is how many of you have noticed the word narcissism or
it's
narcissistic
everywhere.
Personality flying around, right?
Yeah.
Everybody's defining everybody else that way. Yeah.
Exactly.
Yeah.
And there is a personality disorder that is narcissistic person. That is a thing.
Yes.
But that label, I think, is a lot of times applied a little too freely to a lot of different circumstances that might not rise to the level of a personality disorder. So, and then borderline, like in mental health, if somebody gets the label of borderline personality disorder, that's really, it's like a scarlet letter on them. People see that in a chart. They're like, oh boy, here.
Yeah.
There's a lot of stigma in the healthcare community.
Yeah. So I wonder if we can situate this a little bit more with some background and then just acknowledge what we are going to try to address and what we aren't going to try to address. And so one of the things that was most helpful for me in my graduate training was, why do we have these names for things? And the way I was taught was, it's way easier to situate a cluster of experiences and behaviors and go, oh, that's this, instead of like it's random. Like, they sometimes do this, they sometimes do this. And the primary purpose that I was taught was that so a professional could speak to another professional for the good of the individual and say something like, I'm working with a client and they have major depressive disorder. And so instead of listing 14 different things, we clustered all of those things into a name so that one professional could talk to another professional in kind of short form. And then you'd know, oh, that's what that is. Because these names were originally out of the DSM, if I recall. And the DSM is a book that's for professionals to be able to understand the behaviors of a person, to be able to go, oh, okay, this is what I'm dealing with. This is what the research says about this person. These are the various treatment modalities, et cetera. But it's like the DSM has gotten out into the culture and is now just this thing everybody's looking at and using and whatnot. Bob, was that the same for you and your training and formation?
No, and I understand the value of that, but I was trained as a marriage and family therapist, and I was not trained in psychiatric or psychological DSM-3 things. And I have a real aversion to the way that labels get used. I've been on the side of, I don't like the labels at all because of what, Christin, you said. You put a label on somebody and all of a sudden I no longer see the person. I now see the label, and they create fear. At least they do in me, just as you described. Okay, somebody's labeled this way, and because they're labeled this way, I'm either not going to take that person as a therapist because I know what that's going to involve, or I start off looking at that person through the lens of their diagnosis rather than seeing them as a person in the image of Christ. And and that's where I have a lot of difficulty with this issue of labeling. And yet I see the value
of the language you're describing, Jake. So I'm not downplaying the whole value of understanding diagnosis, but I don't like the way that it operates and gets used.
I would agree. Yeah. I mean, it absolutely was, it originated, that system of the DSM originated as a way that so professionals could know that they were talking about the same thing using a common language, but it people look to it to mean more than it is. It's a list of diagnostic criteria. And so somebody has 5 of 9 criteria for depression, more days than not over a 2-week period. So they've got the diagnosis, but that says nothing about what is causing their depression or what would be required to fix it. It's simply a descriptor. With personality disorder, the thing that I really, really resist is the idea that there is no hope. That someone has a personality disorder, that they are broken, they came into the world that way, and there is no hope for them. And I mean, that's just false. I was actually literally taught that by one of my supervisors in I think medical school. And it was probably somebody that really didn't think through what they were saying, but they were like, yeah, this person has borderline personality disorder. That doesn't change. She's not going to get better.
Wow.
And even the modern research on like dialectical behavioral therapy, which is the kind of gold standard for treating borderline personality, they do these studies and they show that they put someone through a course of DBT, ideally 2 back-to-back, which takes a full year. And at the end of that time, the person who originally met the clinical criteria according to the DSM, checked all the boxes for borderline, at the end of that year, they no longer do. Now they might have, 3 of the whatever, but they don't meet the same criteria. And the thing that's changed is their behavior. They've essentially in that year period been trained in virtue. They've learned to manage their internal distress in a way that may relieve some of it and also may not manifest the same problematic behaviors. They're not externally, acting out towards others in the same way. And so has that person been cured of what was originally labeled borderline personality disorder? Not really. I mean, the same underlying stuff is still there, but it's being managed in a much better way. And there probably has been some improvement. So even there with just secular diagnostic labels and secular treatment methods, it's better not to say that someone has borderline personality. It's better to say that they're manifesting it, because the manifestation can change. Having something sounds like it doesn't.
Yeah, it becomes an identity.
Right.
Yes. Yeah. I'm hearing us nuance several things that I think could be really helpful for our listeners to situate this. And Bob, we were extremely intentional with this when we started this podcast. We did like a 6-part series basically on anthropology. And what I'm really noticing are several domains all overlapping here. One is anthropology. What is a human person? The second one I'm really hearing us just talk about here is truth. The truth of our humanity in its broken state, in its glorified state, et cetera. That's another domain that we're circling around. And then the last one, and scripturally the most important one, is love. What does love require? What does love ask of me in this particular situation? So, Bob, I'm hearing you nuance. Labels they influence love or the capacity to love. A label that, I know this person has X, therefore it might be now harder for me to love them because I'm now battling the mental dynamic in me toward them because of, I believe blank and blank and blank about them. So I'm just hearing these domains that I think are super important. So,
yeah. And I would add a fourth one,
please.
What we were just talking about, which is healing and redemption.
Yes,
in these areas.
How does change occur? Which is the series where we just are coming off of a few episodes ago, because all of these things are so important to healing. And if you have a skewed understanding of them, it affects how you treat people. Mm-hmm. And we're right at the heartbeat now of Christianity again. So this separation of Christianity and psychology to me is massively flawed.
if I can put this into the context of the wounds, the beliefs, and the vows, it runs right back into it, which is if I've judged somebody as borderline or narcissistic, that is a protection of my heart against a place of being wounded. And I begin to make vows out of that, whether they're conscious or unconscious. And then that reinforces that person's identity. So we're right back to the anatomy of a wound, whereas the wound is the issue in the first place. And I'd really love for Christin to go into, as you've worked with people with these personalities, like what's the wounding that's underneath that? And I don't know if that's the direction you were going, Jake.
Yeah, I think it's great. I just want to acknowledge some of these domains so that people can situate the understanding of personality disorder. We're standing on concepts that we have to label if we're going to do a good job of breaking open personality disorder. But now, Bob, I'm hearing you nuance something that's in all of those domains, which is like the difference between behavior and wound. Is that there's a nuance there. And again, I want to make it clear so our listeners can track with us, because this is stuff we think about more than the average person.
Uh-huh.
Can you be healed and just have your behavior change is a way to ask the question. So is it possible to only change what I outwardly do and still have a belief in my heart? Is that healing? So virtue theory comes into all this. So it gets juicy quick, which I think is really fun. So Bob, is that a fair way to state the question before we put it to Christin?
I'm wondering where your heart is with it, Christin, in all that we've just discussed.
Well, I want to throw something out really quickly, and this has nothing to do with Catholic. Well, it does have something to do with Catholicism, but this was something I was taught in secular training, which is that feelings follow action. And so, if you act like you love something, over time you grow to feel love toward it, and we see this with children, with pets, with our spouses. If you act, and actually that's where it came up in the context of talking about working with married couples. If you act like you love the person, even before you feel loving toward them, then the feelings will follow over time. So can you just change the behavior without changing the underlying feeling? No, I don't think you can separate them that way. And I mean, St. Thomas would say that we can't, but just in practice, in our own experience, it is true that the way that we act does start to bring our feelings along with it, but it's a very complicated process. The DBT model, that's what we do a lot of is changing the behavior. Although at the same time, there is an effort to, there's the modules on relaxation and, mindfulness. They're really trying to help equip people to, I guess that is behavior, respond to their internal turmoil in a different way. And over time that does change. But if I could go back to sort of the whole concept of what a personality disorder is and sort of share with you what how I've kind of come to understand it and the little sort of elevator speech that I've come up with around this, and then how this actually came about. So I have a patient who is an identical twin, and that person's twin is poster child for what everybody thinks of when you think of borderline personality disorder. This person manifests all of it. Whereas my patient, who is the twin, has a lot of this, shares a lot of the same elements. Same upbringing, same uterus, they're identical, same DNA, same parents, same childhood, right? But it's not the same, because those two people are very, very different. My patient is not somebody that you could label with the secular diagnosis of borderline personality disorder, although there's traits. And she even identifies, gosh, I really can relate to that diagnosis when I read about it. So all that to say, I like to think about personality disorder or otherwise coming from three things. One of those is inherited, temperamental traits, the stuff of our creation. We come out of the chute, so to speak, with a certain set of characteristics, and a lot of those run in families. There's a hereditary component, so that's one. The second thing is the effect of foundational early life experience, especially if there was significant disruption, neglect, trauma. But those early years, that earliest year even, really, really formational, and influential in determining what becomes our personality. And then the third thing is there is an element of individual choice. And it's not always choice like, oh, I'm reasoning through all these alternatives but we do make choices even before we have the full use of our reason as very, very small children and even in, fetuses. We do have some autonomy in how we choose to understand and respond to something. Now, some people will say, oh, but that really wasn't a free choice because you're influenced by this, you're influenced by this. Well, there is an element of free choice in there. And again, I think back to this twin patient of mine. They came out of the same uterus, but one of the two of them came out with a chip on her shoulder. And everything that she experienced, she externalized the blame. She looked for someone else to make it right for her. The other person that became my patient was constantly turning inward and constantly seeking to take responsibility for things herself and not expecting other people. In fact, she was constantly feeling let down and disappointed by other people. And in fact, I this is a little bit of a hypothesis, but I had asked her about the circumstances of my patient, the circumstances of her birth. And she said that she was born first, but her sister was much larger, which that is a common or a known situation in pregnancies where sometimes you'll have a twin that's kind of sitting on top of the other twin, and there can be this twin infusion, I forget what it's called, infusion syndrome or whatever, but basically they're sharing a placenta and one umbilical cord is much larger than the other one. And so essentially one is starving the other. And it's so interesting that actually the twin that was well fed in utero was the one that ended up being the one externalizing blame, like looking to other people to almost like there was this competition between the two of them, even in the womb. And then the smaller baby was born first, and then the other one maybe was mad about that. It's so speculative, of course, but it's so interesting to see that there was a pattern set up very, very early in their lives of of their habitual response to the things that they experienced and seeking to externalize that responsibility or seeking to keep it to themselves. And the thing is, we all have those formative experiences and we all make choices about how to respond that originally are not well thought through choices. We're not fully, using our reason. But then it gets reinforced over time. That the thing to realize, though, is that as adults, we have the opportunity, we have the capacity to understand what happened and to make a different choice and to allow the Holy Spirit to help us here and to try to see where are there choices that are being set up, are there patterns of behavior that are being set up that are basically that are ungodly self-reliance, that are ways where we are trying to protect ourselves from a threat that no longer exists. And that's where making that choice, doing that healing work, and sometimes finding one of those foundational wounds and unpacking it, healing it, that can truly cure what would otherwise be labeled a personality disorder.
Mm-hmm. Bob, have you found that those three criteria, how does that resonate with your experience? So Christin, I really appreciate the three criteria. There's like temperamental genetic stuff that a lot of people would label as dormant, and meaning you can't change it. That's up for, we could discuss that. And then early childhood experience, and then the influence of action and behavior and choice. In your experience, Bob, have you found those three to be the primary influential stuff you're working with in healing?
Yeah, I think that represents kind of the fundamental nature, nurture, and human freedom, right? That's That's what I think that's kind of across, not just in terms of personality disorder, but across all of our behavior. We have genetic influences, which are we have found out that there's epigenetics, which genetics can change. So it's not fixed, but it's there, it's present, and it's a precondition. And there's temperament, and there's all kind of things that get passed down. And then there's the influence of the environment, which starts in the womb. And then there's the individual autonomy and freedom and choice, and that each of us has that freedom. And then I would add grace as a fourth thing.
Absolutely.
Which maybe is part of that environment, but I think it's more than the environment.
So I think this is why this conversation could go on for 7 hours, because we could just take the epigenetic discussion and, the discussions that a lot of the modern neuropsychology folks are doing with intensive research on is nature nurture still the argument? And, some people saying nature is nurture and nurture is nature. Like you can't separate them. There's so many areas we could go into, but I think, Bob, I would say the same. All of those three domains, Christin, that you're talking about, I've experienced them all. And I think the point I'm trying to, tease out is in the healing journey, what's the emphasis? Should I, if I'm sitting back and I'm struggling with something, should I really go after my temperament, quote unquote? Or should I be more focusing on my behavior? Or should I be focusing on early childhood experience? And I think that tension is what throws a lot of people, and even in the Catholic world, creates these camps where, why are you focusing so much on your childhood? You can't change it. It doesn't matter. Just develop virtue. And there's an argument. There's a reason to that makes sense. But to have that be the totality of the argument, I think is dangerous. So, Christin, what would you say about that with someone saying, I'm broken and I want to grow? What do I emphasize? Like what do I pay attention to?
Well, here's where I find that Thomistic structure, that Thomistic ontology so helpful, because, unlike in modern mental health, where we just define mental illness by, it looks like this and it quacks like this and it swims like this, therefore it's a duck. St. Thomas, it gets a little more precise, and he says that, mental illness is basically when the intellect isn't free to function as it is designed to. And so then you can look at, well, what is it that's impairing the intellect's ability to function? Where are we departing from reason? And then fix that. And a great majority of the time, it has to do with emotions. And emotions are tied to memory. So it may be because of a foundational memory that's provoking a specific emotional response, and those emotions will override everything else. I mean, when it's like you're trying to go through the grocery store and get your shopping done, and you have a kid that's dragging on your sleeve, and taking you back to the bulk candy section, That's what emotions do to us. They drag us down, they distract us, they keep us stuck. And so healing, most fundamentally is forming the intellect and conforming the will to God's. I mean, that's the reconciliation of those higher faculties, our soul, with our Creator. That's true healing. In order to do that, we're going to have to necessarily clean up our behavior and our memories and all of this other stuff. It's not an either or, it's a both and. We're all one body soul composite. So I love that Thomistic understanding, because it's so helpful. And I might mention, I got this from Dr. Sue Bars, the image of a sailboat. And I just think this is so beautiful and so instructive. So if you think about the faculties, your human faculties as a sailboat, your intellect is the sailor, and the will is the rudder. The emotions are the wind in the sails. And so if your intellect is the sailor and it's responsible for setting the rudder, for setting the sails, for deciding when to tack, whatever. If you've ever done any sailing, you know that it's not as simple as setting those things and letting the wind take you where you want to go. It doesn't work like that.
Yeah.
Because the wind is not coming at, directly over the back of the boat. It's coming at an angle. And you have to your intellect has to constantly be in charge. And so you might have to zig a little bit and then zag the other way and reset the sails and adjust based on how strong the wind is and all these things. But if the intellect is in charge, you're still going the same place. You have to constantly adjust based on the wind, based on where those emotions are going. But when everything is working together, strong emotions aid you in virtue. They propel you, that you fly across the lake or the ocean or whatever. But if they're not, if your intellect and your will are not set right and the emotions are blowing, the wind's blowing crosswise, you're gonna sink. You're not gonna make any progress. So I love that image because it really does have to be all three working together, and that's when when we're at our best, when we're able to have the most merit in the things that we do that are virtuous, is when all those things are working together.
Yeah, I hear integration as I hear you describe that.
That's cool.
Which is the definition of chastity, which is a definition of wholeness.
Absolutely. And maybe now's a good time to mention my sort of mental picture of the perfection of what would otherwise be borderline personality disorder.
Yeah.
Mm-hmm.
So if you have somebody who has all the ingredients.
So 1 second, Christin, is there a reason you're going into borderline personality disorder, or is this just an example?
Is an example.
Okay, great.
There would be a perfection. There's a perfection for anything God created. There's the grace perfects nature. There's a perfection of it. He didn't bring anyone into the world as a cautionary tale for everybody else, right? He didn't do that. Everything he created has a perfection. And so with something like borderline personality disorder, which is where, the conversation began as we were planning for this podcast, it seems like such a tragedy for so many people, that stigma, that label, that sense of futility. And yet, if you have a very sensitive emotional temperament, which people with borderline personality generally do, if you have some experience of deprivation or neglect or trauma in your early life, which again, people who manifest borderline personality disorder generally do, and if you have throughout your life purified, perfected your choices to be so fully aligned with God's will that it allows for that perfection, you end up as a saint. And not just any saint, but a particular saint who is extremely sensitive, perceptive, able to intercede on a level that other people can't perceive other people's needs the way that someone so sensitive can. And then also to have that degree of compassion based on your own experience of trauma. Anyway, the poster child for this, for me, I always think of Saint Therese of Lisieux, because she was a very, very sensitive soul. And she had a lot of terrible things happen to her early in her life. And she became such an incredibly gifted intercessor, so incredibly sensitive and compassionate. And, she's spending her heaven doing the same thing that she did on earth, interceding for people in need. So that's the perfection of that. And it's the enemy's desire that it get, derailed and turned into something disordered. But that's the perfection. That's God's idea.
So I love the nuance of what you're saying here, because in the midst of a diagnosis, which can be a difficult burden for someone, what we're nuancing is, I call this a superpower.
Yes.
So there's a superpower that goes along with what often, when it gets out of hand, that superpower often becomes diagnosable. So the sensitivity that an individual brings, that if it gets out of hand and can lead to manifesting the symptoms of borderline personality disorder, that superpower of sensitivity can be an incredible gift.
Yes.
The intuition, the attunement to an individual is like a superpower. It's off the charts. But gotten out of hand, reason, not ordering it, it can get really messy.
Yeah, not tended to with sensitivity from those around them who don't get the person who has that kind of sensitivity and calls them oversensitive and reacts to their emotional responses in a negative way. All that just traumatizes.
Yes.
And it's like the gift of sensitivity, to use this as an example, is given. There's a gift given by the Creator, by God. But when you combine that with, like you're saying, Christin, of negative early childhood experience, and then a loss or a deformation of the will and the intellect, you're going to end up with that gift now turning sideways. It's silly, but this is how my mind works. It's like the X-Men on the movie, The X-Men, when they go to the school and they're all trying to figure out how to use the superpower. But what you see often is the superpower being massively distorted, and it's dangerous. Like the guy that has the laser beams coming out of his eyes. If he doesn't learn how to work with that, he'll kill people. And so him going to school is literally learning how to deal with the superpower. And if he goes around and like shoots everybody and they die, yeah, that's not so good. We might put a label on that guy, The point I'm getting at is all of us are tasked in a way with the ordering of the gifts that God has given us. And those gifts can go sideways if we're not careful.
Yeah. And if I could just add, and we have two superpowers to add to that, which is either the Holy Spirit or demonic spirits.
Wow.
And so the Holy Spirit, the ultimate superpower,
yes,
will redirect it into perfection, and the demonic will redirect it into destruction.
Yes. Christin, let's go back to something you said. I was like, oh man, I want to linger there. You very casually mentioned the definition of that Aquinus would give to a personality disorder. Like if Aquinus were today and we walked over to his office and said, hey, what is this? And he would explain it in such a way. And if I recall what you said, it was all personality disorder, Aquinas would say, is the disorder of our intellect. How did you say that again?
Well, so he's not even talking about personality disorders. He's talking about mental health. So mental health per se is that quality of the possible intellect by which it acts according to its own nature. So to kind of translate that, mental health is when your intellect is functioning as it was designed to.
So mental health is when your intellect is functioning as it was designed to. And wounds are things that pull the intellect into all kinds of wonky places. And so therefore there are these things that we have to work with to let the intellect do its thing.
Right. So he defines mental illness per se as a defect or defects in the possible intellect, which makes it incapable of rational judgment or reasoning properly. One acts contrary to rational principles.
Huh. So then when the stuff that's Aquinas would say there are things, there are experiences, there are entities that are affecting us. And Bob, you listed them: the Holy Spirit, demonic spirits. We listed them earlier: trauma, wounds,
temperaments,
all that.
Yeah, there's lots of things affecting us, but it does come down to, we have a choice. And Bob says, the Holy Spirit or an unholy spirit. I mean, it's Mary's fiat or Lucifer's fiat, like we talked about the last time. I mean, we really do have a choice, one of two directions.
And so sometimes the choice is hard.
Oh yeah.
And when the choice is hard, is it fair to say that we're probably dealing with a lack of virtue, which another way to claim a lack of virtue would be these things that are pulling me in the wrong direction? Now, I still have the capacity to choose, at least to some degree, but when I've got all these things pulling me in the wrong direction, have traumatic experiences from my childhood that have led to beliefs and lies about myself and judgments of other people, I can still choose to do the good, but I'm not necessarily as free as God intended. in that whole domain. And so healing is is both and what you said earlier, Christin, of the development of the virtue to get habitually choosing the good, but also the removal of the impediments or the struggle or all the stuff pulling me the other direction.
Right. Resolving those obstacles to the action of grace in our souls. Because as soon as we unite our wills with God's, his grace assists us. That's, just like when we unite our wills with someone else, those spirits assist us in that direction. So we're getting that supernatural assistance each time we make that choice. But yeah, the cleaning up the wounds, healing that memory emotion interface, settling down the emotions, just simply getting into the habit of not making decisions when you're in an overwrought state. Even just that allows the higher faculties a little more room to work and to discern and to make better choices.
Yeah, if I can add a dimension here, I have had experiences with several different people who've had these kind of diagnoses. And 3 situations, I've had people come back after what they called miracles of prayer, where they were set free from whatever it was, and they went back and they no longer had the criteria. So I have seen that on the one end.
Yes.
On the other end, I've seen people come to healing conferences and get a degree of healing and wrongfully conclude that everything's gone, and they get themselves off the medication. They don't go back and get checked. They don't go to the doctor and get, where they are. And then everybody then judges the healing process because this person acted imprudently in terms of getting off the medication that they're on and beginning to act out, and they think they're healed.
Interesting.
I've seen both sides of that.
Yeah.
Bob, it's an interesting thing I think we're hovering around that I want to try to make explicit. I don't know if our listeners would pick this up, but I feel like I'm perpetually trying to get the definition of healing that you carry in your bones explicitly stated in ways that lots of people can understand. Because again, I'm thinking again of the camps, because you're kind of describing some camps there.
Yeah.
And in this conversation, what I'm hearing us nuance is that healing is the both and of all of these domains. In the past, Bob, we've talked about it like healing and maturity. There's almost an unfair nuance that's being made there. Healing is maturity.
Right.
It's not one or the other. And so when I link that back, Christin, to what you're saying, like, and Bob, what you're saying, you can have a emotional wound be healed. And I think most people think that's what healing is my childhood trauma no longer affects me. But that doesn't automatically mean my intellect will start choosing the good instantly. There's not an instant transfer. Would you agree, Christin? There's not an automatic, trauma gone, therefore I'm now virtuous. That's a misunderstanding.
Yeah, there are dramatic things that will happen sometimes where someone will experience a dramatic relief from a particular pain, and it does free their intellect up in that moment, and they'll have this graced kind of, Bob, honestly, you describe it in your book, that the Holy Spirit really visited you and healed something, and great. But healing's never a one and done thing. We're all doing it constantly. And that's why I like that definition of healing as the reconciliation of the soul with its creator. That doesn't finish until we're dead.
And even then, it might continue in purgatory. Yeah.
Right. We're constantly there's going to be a wound that gets healed, but then as we're going to walk forward from that, and we're going to discover now other things that are tripping us up, and we may be wounded all over again by something brand new. So, I mean, as long as we are living, we are working this out, and it's never one and done. But I have had the exact same experience Bob describes of seeing people that, have had some really, really fundamental healings. They are not the same person in a good way going forward. And there are other people who it doesn't matter how many Healing the Whole Person conferences they go to.
Mm-hmm.
Nothing ever changes. It's so frustrating.
Yeah. There was something I was going to address with that. Yeah, as we're talking about definitions of healing, I want to test out the definition you just gave with the definition that we use at the Healing the Whole Person and see where they mesh and where they diverge.
Interesting.
Okay. So healing is an ongoing encounter with God's love and truth that brings us into wholeness and communion. Right? That fits completely with
absolutely
the soul always being in the process of being transformed in God's image until we reach that perfection of state that God designed.
A nuance I'm hearing us say, another way, just maybe I'm complicating things. Healing is holiness.
Yeah.
And again, I'm hammering on this issue because I feel like part of the service that this podcast is trying to do to the church is to reintegrate what healing actually is. It's the restoration of our God-given glory.
Yes.
That's the name, restore the glory.
Yes. And what holiness really is.
Exactly. They're the same thing. And so when people go, I don't need that healing stuff, I'm like, you're misunderstanding holiness. Or people that say, I only need the healing of my memory stuff. No, you're misunderstanding healing.
Very frequently, people think too small. They think too concretely, and they imagine that there's this spiritual cruising altitude that they can get, or psychological or whatever, that they can achieve some level of sanctity in their lives, and their families all going to church, and everybody, is doing the right thing, and their house is clean, and, they can have people over on short notice and not be embarrassed. I'm not there.
Yeah.
But that what they don't recognize is if they achieve that, if any level of mastery, you achieve, you always level up like a video game. There's going to be another level to it. It's a process. God is so far beyond us that he's calling us to deeper and deeper levels of reconciliation and healing and all of this. And it is an ongoing process. It's not just not just a one and done.
Is there any other nuance we would make there with regard to, Bob, the two definitions that you listed? I mean, I'll jump into that and offer an example. Christin, when I hear you describing healing is the perfection of who I am into the image of God. That's not exactly what you said, but that's what got in my head for now. And then what I'm hearing is there's an echo of the same thing. The definition, Christin, I'm hearing you use is a more broad, simplified definition. And Bob, the definition I'm hearing you use nuances some of the stuff that goes on within that process. But they're saying the same thing, maybe just at different levels of detail. Bob, would you agree? Is that?
I agree. Yeah.
Yeah. Christin, would you agree too?
Definitely.
Yeah. So maybe we can begin to wrap up our time together today with this concept of virtue. I think it's something that, Bob, we don't necessarily talk about explicitly a lot, and I think it can be helpful to nuance this a bit, particularly, Christin, with your knowledge and expertise and formation in the Thomistic psychology, et cetera. So what we're claiming here and what we're saying is true is healing is the development of virtue. That is an essential part of healing. Healing is also the transformation of a memory or an emotional dynamic that comes through communion with God's love. So if we nuance the development of virtue, Christin, how does one develop virtue? What is virtue? How do you develop it? How is it healing? So summarize the summa. Could you for us here just real quick?
Yeah. Before she answers that, can I just say one thing real quickly?
Please.
In relation to what you said, Jake, that it goes back to security, maturity, and purity. Security is the experience of being loved in the ways we haven't been loved. Maturity is growing in virtue, growing in holiness, growing in the capacity to love with Christ's love. And purity is the perfection of that in our life.
Yeah, the expression of that given to another.
Yeah.
Which my life doesn't end with myself.
Yeah.
Yeah, it's inherently, yeah. So, okay, Christin, it's not fair, but let me, my question isn't necessarily fair of just being like, summarize all of Aquinas's theory of a virtue. But I think, let me kick us off with the simple definition. Virtue is a habit. It's a thing that comes naturally to choose the good. The way that I like to put it is, it's the instinct that to the good that doesn't necessarily just happen with a snap of a finger. In some areas of my life, I really like Christopher West's nuance here, where he said, most of us in this room right now, I was at a talk, have the virtue, I don't know what the name of it would be, but where I don't need the commandment that says, thou shalt not murder. So I'm virtuous there. It's my instinct not to go kill everybody. So got that one. But there might be a loss or a lack or a void of virtue in some other domain, whether that be lust or gluttony or anger or whatever. So am I right there, Christin, that it's the consistent habit?
Yes. Yeah. I mean, that's the most sort of simple, fundamental definition of virtue that I know, is just that it's a good habit. But if you understand the Thomistic anthropology, you understand what that includes.
Okay.
It necessarily includes a choice of the will that is in line with God's will, and that the beliefs are in line with those things, that the intellect is formed in the truth as God sees it, good as God defines it. God doesn't just define good as your house is clean and you can have people over on short notice. God defines good as our eternal salvation. And so again, getting those beliefs in line with the truth, our actions becoming habituated to the good. And in order to do that, it presupposes that our emotional life is conducive to that. It starts to permit it. It starts to allow the intellect to reason freely and the will to act freely. And then again, that the sailboat, everything's working together and it's taken off.
Can you have a virtue and have a ton of emotions that resist the virtue? Or are you still in the process of becoming virtuous?
That you would still be in the process of becoming virtuous. I mean,
Okay.
that act might be, a virtuous act, but you're not virtuous in performing it if your soul is full of resentment and anger and bitterness and, all of this.
Okay. I think that gets confused for people.
Yeah.
They're like, look how virtuous I'm being. And then they leave the thing they were virtuous. And then on the car ride home, they're just ripping the person to shreds, No, I'm not talking about myself at all. I promise.
So that's the sailboat with the rudder set.
Okay.
And the sails, a certain direction, but the wind is coming from another place. And so the boat's not going where it needs to go. It's not making any progress.
But help me understand, because in that case, it is in one setting, I was nice to maybe the person that irritates me, but internally, I don't want anything to do with them. To you,
right? So again, so maybe you get a gust of wind that just happens to be in the right direction, and you make some progress with your boat. But now the wind changes, and you're so under just the perfect circumstances, you're acting virtuously, and you're feeling, your feelings are on board with that, but you change any of those variables, you get outside your comfort zone and you cannot generalize that virtue. So it's not as much of a virtue as it really, as you would think.
Yeah. I don't know if this resonates with you guys, but the analogy that's really helping me with the boat is I can visualize myself being virtuous and I am working my tail off. I am holding onto the rudder as hard as I possibly can. I'm repeating to myself, go this way. And the wind is all, because I'm trying to manage the wind not going in the right direction, but I'm like gritting myself through it. And in my life, what that leads to is the virtuous act isn't consistent. It doesn't last very long because I'm white knuckling.
Yeah. So, so immediately springing to mind here is Saint Teresa of Avila's flower garden. And the way that, I mean, she's talking about it in the context of prayer, but you could apply it as well to, the exercise of the virtues. When you start out, it's a lot of effort. You gotta crank that winch and get that bucket up from that well. And it takes a long time and you don't get very much water out. But, the virtues are the flowers in that garden. And as we grow, as we order our faculties, as we heal emotionally, as we form our intellect, all of these things get easier. And now there's a pump, and all you have to do is work the handle. And at the highest levels of virtue, we're just sitting there and it's raining. And that's what's watering the garden. God's doing all the work for us. He has perfected our souls so much that all we have to do is receive.
Bob, what's coming up for you here?
I'm having a lot of different thoughts, but I like that description of the difference between white knuckling it and sometimes that there is a process to overcome the barriers. I was thinking about your example being like maybe your intellect's in the right direction, your rudder's in the right place, and there's a gust of wind that's different than the normal pattern of the wind. And so it throws you and you have to really be steady on the rudder and keep in that direction. And it takes more effort. And then you have to adjust the wind, the sail a little bit to get in the right place. But then the sailing becomes easy again, as opposed to what you're talking about, which is, there's this gust of wind and I keep my rudder there, but then my rudder goes all over the place afterwards and my direction goes
and you go in circles.
Yeah.
Yes. Yeah. I think the way that we've typically described, the way that I've thought about this before has been, it's good enough if the outside is virtuous. And then you go and look at Jesus's words like to a T. He says that's not like you can clean the outside of the cup, but you're still whitewashed tombs.
Yes.
Like that principle is a really important principle with regard to healing. So you could do an act on the outside that looks good, but your soul is still dead. And the irony there is he's talking to the Pharisees. I think something that we have to be really careful of as Christians, particularly as Catholics, that's me, I'll convict myself and my brothers and sisters who are Catholic. The integration that's required by Jesus Christ and the church himself says the outward behavior alone is inadequate. That is not enough. And if you proclaim it to be enough, you are modeling yourself exactly after a Pharisee, who Jesus had some strong words for. Yeah. So this is why the definition of healing to me is so important, to really get it.
And at the same time, it's important that when we have all the storms going on in our hearts, that we still direct our intellect and our will in the right direction.
Yeah.
As we work on those storms in our heart.
Yeah.
And I think too that it really, it's so important to recognize that even though we're not doing it perfectly, we're still, there's parts of us that are lined up. There's other parts of us that aren't. Just as we wouldn't want anyone to judge us based on the mess of our external, actions, we too need to refrain from judging anyone else based on, there's that quote, everyone is fighting a battle that you know nothing about. Mm-hmm. That there may be virtue there that you are not able to see yet, mm-hmm. but presuming in charity, presuming the goodwill, presuming that person is doing what they can. And right, circling back to the idea of personality disorder. Yeah. Just don't label, don't judge, don't presume that there is not healing going on or healing possible.
Amen. Amen to that. Any final thoughts? Anything else we'd like to say? There's so many loose ends we could have gone to. We acknowledge that again, the conversation could go on forever. I'll kick us off, let you guys think about that for a moment. I so appreciate the church in conversations like this and the pedigree, the longevity, the depth of thought, the gift of the Holy Spirit. I mean, it's folks like Aquinus who we stand on the shoulders of to be able to understand these concepts about the human person. And, so many great theologians. I just am so grateful because I literally don't know how I would function without these truths being like gold thrown at my feet for the opportunity for me to just pick them up, treasure them, integrate them, and my life has a way better possibility of being good because I know what is true and not true. And again, that's why I think this stuff's so important to study and understand because it informs you how to live, how to be happy. So I'm just grateful for it.
Very true.
I should mention, so the formation that I've gotten, the education that I've gotten in this arena, in Thomistic psychology specifically, I mean, there's a lot of people that are expressing interest that are really enthusiastic about it and wanting that education for themselves. There is going to be, I mean, it's kind of a skeletal website right now, but a formation program in this, it's called the Thomistic Institute of Psychology. So I can give you the link to put in the show notes, ThomisticInstituteofPsychology.org. So there's some very, very minimal stuff on there right now. But the idea is it's going to have like 100 level, 200 level, 300 level, 400 level. You can go as far as you want to go with this. But at those basic levels, those are some lectures I'm going to be giving as one of the instructors. There's going to be others as well. But we're going to be talking about these very things: virtue, the basic structure, the ontology of the human person, the faculties, and how my particular emphasis, my particular desire is for modern mental health practitioners who happen to be Catholic to understand how this applies to them, how this can, as they internalize this understanding, as they internalize this truth, it will transform what they do and make it more effective. Because if we, if we're respecting the truth of how we were created and how God designed us to function, and so then everything we do is seeking to restore that in a very intentional way, that's only going to benefit people, whether or not our patients are actually aware of the fact that we're practicing Thomistic principles. But everything we do in modern mental health can be made even more fruitful and specifically virtuous as a result of this stuff.
Amen. Bob, final thoughts?
Yeah, I love what both of you are saying there, that we need that grounding in truth, and the church is that grounding. And St. Thomas Aquinas, certainly a champion of the church's teaching in truth. And I want to say something kind of unrelated, which is, as I was thinking about all this discussion, I have run across people who have been diagnosed with personality disorders, that a lot of the traumas are early childhood traumas and attachment traumas. And just wanted to mention that sometimes it's difficult to get down to those areas of trauma because they're so well protected and they're so foundational. And so sometimes the healing process with someone with a personality disorder takes longer just to build the trust and the security. Sometimes it can happen miraculously. Sometimes there's been a lot of preparation. But just to say that, somebody's desiring to be healed and freed from what has been a pattern of destructive personality behavior and intuition, that it's going to take a lot of work and a lot of grace for those areas. And sometimes God can do it in an instant, but most of the time it's a lifetime journey.
He loves process, doesn't he?
Yeah.
That's so true. And our will, this too becomes an opportunity to conform our will to God's, because our will would be for it to be healed, by the time we're 35,
Yep.
so that we can, live the rest of our lives in this blessed state of integration. And yet God's will is for our salvation, period. He wills that we become saints, but he doesn't say when. He's got the long game in mind. He wants us to be saints at the end. We're looking at it in a temporal way. We want it now. So again, just because somebody is struggling to achieve or sustain or whatever that healing throughout their lives doesn't mean they're not being successful.
That's good. Christin, it's such a blessing to have you on here. I just want to thank you for all that you are doing. We'll have your links and websites and all in the show notes, and listeners will also have that link to this new Thomistic Psychology Institute, and looking forward to encourage you to check all that stuff out. The riches of the church feel endless at times. And so if you're passionate about healing, and I really encourage this for all of those mental health professionals out there, especially those students, Bob, we get all kinds of questions from students who are like, what do I study? What do I emphasize? That this would be one of them. So listeners, we hope that this episode blessed you, and we look forward to talking to you again soon. Bye-bye.